If you're preparing for the PEBC qualifying exam part 1 and you're not sure where to start, what to study, or how to structure your time, this video is going to fix all of that. We're breaking down the full syllabus, the best resources, and giving you a realistic study timeline you can actually follow. Let's get into it. Before we talk strategy, let's get on the same page about what this exam actually is. The PEBC Qualifying Exam Part 1 is a multiple-choice exam that tests whether you have the clinical and pharmaceutical knowledge required to practice safely as a pharmacist in Canada. Under the current blueprint, the format is stable, meaning the structure hasn't had a major announced overhaul the way the evaluating exam recently did. That's good news for you, because the resources and strategies we discussed today are built to last. Your job is to demonstrate competency, not just memorize facts. The QEI covers a broad range of pharmacy knowledge, but it's helpful to cluster it into buckets. First is drug therapy, pharmacology, mechanisms of action, drug interactions, contraindications, and therapeutic monitoring. Second is patient assessment, interpreting labs, recognizing disease states, and recommending appropriate therapy. Third is pharmacy practice, think dispensing, legislation, ethics, and professional standards in the Canadian context. And fourth is health promotion and communication, counseling patients, identifying barriers, and supporting adherence. Most of your study time should be split between drug therapy and patient assessment, since these tend to carry the heaviest conceptual load. Here's a mistake I see constantly. Candidates open a giant textbook on day one and try to study everything equally. That's a recipe for burnout. Instead, start with high-yield therapeutic areas. Cardiovascular disease, diabetes, mental health conditions, and respiratory disorders come up frequently because they're common in Canadian clinical practice. Nail those first. Rare diseases and niche drug classes, those come later in your review, not at the beginning. Think of your study plan like a pyramid. Build the wide base with high-frequency content, then layer on the specifics. This alone can dramatically improve how efficiently you use your time. Let's talk resources. Because Canada has its own formulary, guidelines, and regulatory landscape, you want references that reflect that. Therapeutic choices in the Compendium of Pharmaceuticals and Specialties, known as the CPS, are both excellent Canadian-focused clinical tools. For active recall, use a question bank that gives you detailed rationales, not just correct answers. Understanding why the wrong answer is wrong is just as important as knowing the right one. Layer on concise summary notes for your review cycles, and consider joining or forming a study group. Explaining concepts out loud to someone else is one of the most powerful ways to find the gaps in your own knowledge. Here's a practical 4-phase timeline you can adapt to your schedule. In the first 4 weeks, map out every syllabus area and work through the high-yield therapeutic categories we mentioned. In weeks 5 through 8, go deeper on concepts and start integrating question bank practice daily. Aim for at least 30 to 50 questions per day with full rationale review. Weeks 9 through 12 shift into mixed review mode, where you're revisiting earlier material and doing timed question sets to build exam stamina. In the final 2 weeks before your exam, stop learning new content and focus entirely on your weak spots and full mock exam sessions. Simulating exam conditions now prevents surprises on the real day. One of the most evidence-backed study techniques is spaced repetition, and most candidates completely underuse it. Instead of reviewing your notes once and moving on, you deliberately revisit material at increasing time intervals. This exploits how memory actually works. Tools like Anki are perfect for this, especially for memorizing drug names, mechanisms, and side effect profiles. Create a deck early and add to it daily. Here's the key insight. You should be reviewing something just as you're about to forget it. That moment of struggle before you remember is exactly when the memory gets stronger. It feels inefficient. It's actually the most efficient method there is. Knowing the content is only half the battle. You also need to perform under pressure. The best way to reduce exam anxiety is through repeated exposure to exam-like conditions. Timed sets, no distractions, sitting down and actually doing it. Your brain needs to get used to that state. On exam day itself, read every question twice before choosing an answer. Many errors come from misreading what's being asked, not from not knowing the material. If you're stuck on a question, flag it and move forward. Getting trapped in one hard question drains time and mental energy. Come back to it fresh. And please, don't sacrifice sleep in the final week. Sleep is when your brain consolidates everything you studied. All right, let's land this. Your first action this week is to map out the full syllabus and categorize topics by priority. Second, lock in your resource stack, Canadian clinical references plus a strong question bank with rationales. Third, open Anki or any flashcard tool and start your deck today, even with just 10 cards. Momentum matters more than perfection. And fourth, block your study time in your calendar right now. Treat it like a shift at work, non-negotiable. If you want a ready-made study guide and question bank that goes even deeper on all of this, we've built one specifically for QEI candidates. You'll find the link to our Etsy shop in the description and pinned in the comments below. Drop any questions you have down in the comments. I read every single one. And if you want to be the first to know when we drop new videos, hit subscribe. More study breakdowns are coming, and you don't want to miss them. You've got this. If this helped, check out these other PEBCBuddy videos to keep your prep going.